So with the VVCA going global, we realize we're sitting on a huge opportunity to gather and aggregate data from large resource partners and leverage those connections to learn as much as we could about what virtual care looks like globally and what those patterns are.
So I think the importance of this report is to aggregate as much data as possible. The industry relies on evidence base when we're using any form of clinical context, clinical reasoning, and we don't have a huge body of evidence around remote care. And so being able to bring together data providers to show huge numbers, which we often miss in the veterinary literature, this was a massive opportunity that we just had to get started with.
It was super exciting to get an international perspective, which I think is such a rare thing. We all are using virtual care, some of us for the same reasons, some of us for different reasons. There's so much need. And so to have an international perspective on it and be able to bring so many different groups together, so many different modalities, and just find some similarities and patterns and understand, have a better understanding to bring to everyone is just really impactful.
I hope that veterinarians, so practitioners, retailers, anyone in the pet industry will look at this report and try to learn from it. I think there's a lot of valuable insights about the consumer and what the consumer needs from all of us.
So this report is for veterinary professionals, for people providing care to pets and animals in the wider industry on a day-to-day basis. There's a huge opportunity to explore here, and we don't necessarily know about what the potential is. So this is here to illustrate exactly how powerful providing care in all of its different shapes and forms can be for those animals as our responsibility.
For those who are sort of questioning, what's the real utility here? Is this actually going to make a difference to people? I don't really understand what this virtual care stuff's all about. I mean, I think it's best for those people really need to get their hands on this report and have a look at it, and just again see what the impact is that virtual care is having and all the different ways it's being used.
I truly believe that this report is for everyone on a global scale, and if VVCA's initiatives recently have proven anything, it's that there's a global interest and need for more information around virtual care and really what it is that the consumer wants and more than that needs. And I'm so excited for this to get into the hands of individuals and veterinary professionals across the globe and see what they have to say.
So ultimately, we're all providing the same care, the same level of professional attention to animals. And so we're actually all talking about the same thing. So it's really exciting to be able to show that and also to understand what people are doing in other countries, what veterinary professionals are doing elsewhere that we're not always aware of when we're working within our own jurisdiction. So this is a really exciting opportunity, for example, for veterinary professionals in the UK to see what the US is doing, to see what Canada is doing, and vice versa. And obviously, we hope in the future we'll be able to bring in more data sets from further afield to do the same and continue building this global picture.
Looking at data from different countries, really interesting. There's a lot to be learned as we see the different challenges that different regions face, different pet owners face in different areas of the world. And I think this really broadened our perspectives on what we see. It's easy to get sort of an insular view of what we're experiencing in our own day-to-day lives, and looking at what's happening on more of a global scale really broaden the perspective on what the needs and opportunities are for the industry as a whole. We look through the access to care issues in the United States with data supported by the Veterinary Care Accessibility Project, VCAP. Then we look at data for telehealth utilization globally that is comparative across the 3 regions, the US, the UK, and Canada, and then dive into how that utilization varies across different business models. So guidance-oriented business models being those that include teletriage, teleeducation, teleadvice type services, and treatment-oriented services that include those that performed remote VCPR consultations and or telemedicine appointments within the constructs of a traditional VCPR. And finally, look at the legislative landscape in all 3 of the regions covered in the report.
So for me as a veterinary professional, it's really important that we practice with evidence, and we rely on evidence-based veterinary medicine to guide us. That's what we hope to have in helping us make our decisions, no matter what our patient has, what the clinical presentation is. And we really lack this evidence base in remote care. So I'm really excited by the sheer volume of cases that telehealth offers, both in the human field and the veterinary field, to help us progress, better serve our clients, and ultimately get better clinical outcomes.
I think we need to base what we're doing on facts. And up to this point, veterinary virtual care was so new and fresh to everybody that there is a lot of fear around it. Am I potentially going to bring harm to my patient if this is the modality, this is the way that I'm performing medicine? And I think having some facts to back you up and say, no, this is a very valuable mode of care, and there's very little report of any issues, any complaints, any problems with delivering care via telemedicine or teletriage. I think just being backed by the facts, and that's going to keep coming up as we move into the future. So that's really exciting.
Probably one of the most interesting things that we learned in exploring this was the variety of applications of virtual care and the way that it could be deployed. Seeing how different countries, different regions are utilizing and leveraging these technology solutions in their day-to-day practices was really an eye-opener for all of us.
I think innovations might touch a little bit on what Graysen and Nicole said, but I think that innovation also applies to just being creative about our models and how we're delivering care. And clinicians would understand this better than anybody else because you're faced with a million different scenarios on a daily basis. There's so many applications for models of virtual care that maybe no one's even thought of yet. And so I think we see a lot of success happening out there in the world with utilizing these different things and an opportunity to really get creative about how we deliver that care and how we can optimize access to care for a lot of patients that maybe weren't able to acquire that before. So I think that for me is more innovative than anything else that we really are touching on.
I think veterinary workflows have a huge potential for increased efficiency with the limited resources that practices are experiencing around the world at the moment. And that doesn't seem to be changing anytime soon. So how can we work smarter with the resources and the skills that we already have? But how else can we deploy our skills? We have a huge number of incredible professionals with incredible skills that we want to retain in the profession. And there are different ways of working. So we've been super excited to work with data providers from across the US, Canada, and the UK. And for the first time, this report brings together this global data set. Each provider was sent a survey which requested information about cases seen via remote methods. We also asked for information from each provider about how their business model delivered the care and the different methodologies or channels with which they deliver that care. And the final piece of the puzzle was outcomes and satisfaction data where it was available. So the providers the data providers put this data together and submitted it. And then there was a huge amount of work internally to help align and aggregate the data, because what was very evident was that each provider is collecting data in slightly different ways, classifying cases slightly differently. And so the aggregation process, once the data had been collected via surveys, then had to enable us to bring all the data together into one large data set.
I think The most important things for me in surveying our resource partners were wanting to understand what the referrals to care looked like on a global scale. What were the outcomes to the extent that we could gather them for the pets? We have a very limited view right now on clinical outcomes, like true clinical outcomes. How is the pet long-term, and understanding their condition as the owner reports it, at very least, was a really important contributing factor. So getting to see that on a more global scale was really important to me as well.
The data that this report provides and what was important to show is the scale of engagement and the reasons why pet owners need remote care in its various forms. There are many practitioners facing the challenges of being able to deliver better care with the limited resources they have. And this is a huge body of information to help practitioners inform that evolution of their practice. And so this data, for me, it was very important to be able to illustrate how it's possible and what the options are, and the fact that this is a global conversation and a global task, and that we're all wanting to do the same thing, and how much telehealth and remote care is already going on, how much we can learn from looking at other countries and other jurisdictions and drawing on that immense body of experience that's already out there so that we can continue to grow. And I'm also super keen at looking at the human side as well. So this just contributes to the enormous body of evidence that is growing in remote care.
Yeah, I was really curious about presenting complaints. That was really my biggest thing. I wanted to see the presenting complaints as they might vary by model and by region. I think that's really, really interesting. Patient outcomes, again, to the extent that we're able to measure those currently, I think that will evolve as we move forward and become much more specific and granular. Who are the patients that are coming to see us at virtual care versus who are the patients who are seeing us in physical practices? And I was curious about those potential differences as well. So I think those are the things for me that were most exciting.
I just wanted to further add on this question about how remote care integrates with physical practice delivery, and that's absolutely critical, and this report shows how it can be best done.
Any provider of virtual care services can learn a lot from this report and from the legislative changes. Monitoring what's happening across the US, across the globe, is really important to make sure that we are remaining compliant, that we're doing the safe thing for pets and, of course, the legal thing, but also, importantly, broadening our minds in terms of how we're delivering care. I think that is the biggest thing that can be gleaned from this report, is that there isn't a one-size-fits-all solution. And perhaps most interestingly is seeing how satisfied consumers are regardless of how the models are being presented. This report reflects everything from triage services to full-on 100% virtual services, telemedicine services. So if we're looking at the legislative landscape and all of the changes that have been done in various states and how much those vary here in the US, for any company who is delivering virtual care services to look at those changes and figure out how they can change their models to support the consumers within that legislative framework. This report really can help open your mind to what those workflows could look like to still remain compliant with those laws and regulations.
The legislative landscape is evolving so fast across the world, and it's such an exciting time. And not only do practitioners within Canada, the US, and the UK, which is a huge plethora of diverse jurisdictions in their own right, but we've also got countries across the world where our colleagues haven't started talking about legislating remote care, but there are animals that need help, and there are people who are keen to deliver that help in a remote fashion. And so this report really helps those countries to start the conversation around remote care, which is really exciting, as well as embedding and integrating it in those jurisdictions where remote care has already got off the ground. So there's a huge opportunity for practitioners, no matter at what stage of their careers they're at, or whether they are business owners or not, where they're delivering care and how they're delivering care, to leverage the benefits of this report.
Yeah, I just wanted to add to that as well that the legislative landscape in Canada is quite variable, and there are some regions within our own country, some territories within our own country where that conversation has not yet started. There's no legislation that relates to virtual care whatsoever in some of those areas. So huge impact, I think, that a report like this can have in getting those conversations started.
But I think what's so exciting about this report is that it is putting numbers and data behind arguments that have been winning in every sense in multiple different rooms and different occasions. And so the fact that we now can back these compelling arguments with data and facts is going to be tremendous, because up to this point, a lot of the arguments on the opposing side of whether or not a virtual VCPR should be enacted have not been entirely valid and certainly not backed with data and facts. And so we are really just thrilled to be the resource for the data and facts that everybody has so desperately been in need of.
Is it going to, I think it's, virtual care in veterinary medicine is going to continue to evolve. I think it's going to evolve quickly. It'll be really exciting. This report is the beginning of it. It's just the beginning. We're going to continue to iterate on this as we go, annually, as far as I understand. And I think that we'll be able to, the companies who are involved and the resource partners, I'm sure, are going to grow in number as we move forward. I think a lot of people will be really excited about being involved in collecting all of this data. And we'll be able to really streamline, what are the points that we need to focus on. And it's just going to accelerate the evolution of virtual care across the globe. And I think that's super exciting for all of us.
Virtual care is always evolving. And I think this time next year, we're going to be having a very different conversation. I think this report will continue to evolve as well, as we've learned a lot. I know sitting and looking at this data, I have about 1,000 things that I want to know a lot more about, and we all do. And we're going to get to ask those questions. And that really is the power of getting to do this on a global scale. We are really excited to get to have more people get involved in this and get to see how virtual care is being deployed in ways that we don't even know about. So we're looking forward to having more people contribute and see what the 2024 landscape looks like when we release this report in early 2025.
This report should give huge strength and confidence to those wanting to help retain amazing veterinary talent in their business and in the industry, to better serve pets, and to explore new ways of working. It's an absolute game changer, and it's been done in human medicine for decades. And we've also done it in veterinary care for decades in just different forms. Now we've got the opportunity to formalize it and to bring it into our formal care model in a scalable way. And this is just scratching the surface of the power of telehealth and what the data is going to be able to show us in the future.
I think what's so critical to recognize is that we have to, as an industry, start somewhere, in recognizing that there's going to be tremendous change every day, every week, every month over the next few years. If we aren't willing to really honestly reflect on the current state of where we're at and where we're going and what the consumer is absolutely going to demand, then we make no progress. So this report is really an invitation for people around the world, veterinary professionals of all kinds, to get started and to begin becoming more comfortable with the concept of virtual care.
Perhaps the most surprising thing about the data was the impact of business models and regional access on the actual data points and how that data was captured, and understanding what that meant for the patterns for the utilization for the consumer. The other piece that I think was perhaps most fascinating is the customer satisfaction across the globe and the utilization trends across the globe. Whoever would have thought that the average age of the pets across all regions and all data providers was 4.5 years old? How strange is that? There were really interesting trends that I never thought we would see, and different variances that come down to understanding how even things like whether marijuana is legal for recreational or medicinal use impacts how data gets categorized.
I was so pleased and surprised and proud that the global veterinary telehealth community were willing to collaborate at such scale to bring this report together. It's phenomenal and it's really exciting, and it just indicates at the future potential for this report and for collaboration amongst remote care providers in the future.
I think what didn't surprise me about this report was just the sheer volume of pets needing this type of access to care. There's so much need and so much desire from the public, from the pet owning public, to have access to virtual care.
I think ultimately what our findings led to partially were that there are so many pet parents out there who need to be assisted, and maybe not in a setting where they immediately go to emergency or they make an appointment and they have to wait a couple weeks. Sometimes they just need an answer to that question to guide their next steps from a more educated manner. And this report just really reiterates the fact that virtual care is able to be a tool in a pet parent's pocket to enable them to be the best owner possible and to enable their pet to get the best care possible as well.
One of the most interesting things in this report is that when we look at what the consumer needs and understanding what their pet needs, it may not be an in-person appointment, it may not be an ER visit. Even when we're looking at the different business models, a lot of the pushback that we're getting and the arguments against virtual care, as we know, it's unfounded. But one of the things that's most interesting is that even from those who are performing telemedicine services, telemedicine visits are not necessarily the predominant outcome of those cases.
Sometimes virtual care simply means helping to direct the pet owner to the right level of medical care for their pet, because a pet owner doesn't necessarily understand, is this okay? Can I wait? Can I not? Is telemedicine appropriate? Do I need to go to the ER? They don't necessarily understand that. And even if they think they need to go for physical care, gone are the days when you can just get in a car and drive to your local emerge. I mean, a lot of times the capacity is not there. Sometimes there might not even be a doctor there at all. So they need that access to be able to determine the appropriate level of care for their pet. And I think that's a huge part of what we're doing as well, that sometimes is overlooked by people who might not understand all the ins and outs of it.
And at this point in time, the consumer, almost regardless of their age, is familiar enough with telemedicine and virtual care to recognize the legitimacy behind it. And because they can access it for themselves, they don't understand or begin to even recognize why they would be blocked in terms of accessing virtual care for their pet. It doesn't make sense to the consumer. So I don't think that there is a lack of legitimacy or trust. At this point, the industry is disallowing them to access something that they absolutely expect to be part of their pet parenting process and lifestyle.
As a veterinarian, we do get in our own way. A lot of veterinarians are afraid of virtual care. I'm not going to lie, prior to 2017, I was also afraid of formalized virtual care. I didn't understand what its place could possibly be in my hospital. I didn't. And I was pretty vocal about that. It really took doing it for me to understand myself and kind of looking beyond these walls and understanding what the need really is. So I'm the first to say that I can see where I got in my own way, and I think that we as a profession need to do a little bit better about just opening our minds up and understanding what the needs are, what the opportunities are, and knowing that when I'm in front of a camera, my judgment is this exact same. In fact, I'm a little more cautious when I don't have that pet in front of me. And so I'm not going to throw my, my intelligence, my decision making, my judgment out the window, or certainly my license. So I think we just have to have a little more confidence in our ability as practitioners to think critically and make the right decisions. I mean, we are faced in practice all the time with having to make decisions without all the information. People decline testing or tools that are going to help us to make the most informed decision. We're faced with that constantly in practice. This is no different. So again, I think that there's a lot of opportunity for our profession to move forward with this.
Compiling this report was really about learning why virtual care matters on a global scale and understanding what the pet owner needs from us, an industry as a whole, anyone who's involved in pet care as a whole. And I think for me, the real opportunity here is seeing what a huge opportunity there is in the virtual care space. It's not black and white, and we have a lot to learn from each other. There's a lot of fear around virtual care, and veterinarians tend to be a little bit gun shy about how to deploy this in their practices. And I think there's a lot of challenges that we're faced in terms of workflows and a number of items that can be barriers for our technicians and for day-to-day practices. It doesn't need to be as much of an uphill battle as it feels like it is, because there isn't a one-size-fits-all solution. There's a deep need from the consumer to better understand what their pet needs to be happy and healthy and live a better life. And maybe more importantly, for an industry that is faced with the reality that they're not seeing animals more than once every 3 years on average. What this report is showing us is that people actually want to talk to us more often. We just have to find a way to get in front of them and make our services more accessible to them on a regular basis.
I think on behalf of the VBCA, I would like to note that we, since our inception, have carried a intentional burden and responsibility that aligns with really bringing awareness to virtual care, but not only bringing awareness, providing best practices and education around the implications of virtual care and how to effectively and safely implement it into the daily life of a practitioner. This report really enables us to give information that is credible and valuable and impactful to someone, and we can walk them through next steps and what to do with it. And so as VBCA, we are incredibly proud of this report because it does exactly what we were founded for, and that is to enable the practitioner, no matter where they are in the globe, to make an educated decision around virtual care that is backed by safety and guardrails and data.
I mean, I'm also just really proud. I'm really proud of the VBCA for putting this together. I'm proud to be part of it. I'm proud of all the individuals that came together to produce this report and deliver their data, to share the information they've gathered through the implementation of virtual care with the world. And I think that everyone's ability to come together and to work together on this to assist in understanding the needs of the consumer, understanding the needs of the profession and the professional, prove the utility of virtual care, and in the process relieve some fear and skepticism, which is so critical, and look to the future and all the opportunities that the future holds in terms of moving legislation forward, implementing the proper guardrails, and providing care to animals who've never previously had that type of access. That's exciting for me too. And also providing veterinary professionals, technicians and doctors alike with ways to work that can be good, healthy for them, and other options and opportunities for them. So there's just so much to explore. I'm super proud of this report and where we're going to be able to go from here.